Approximately 7 in 10 primary care patients in Alberta report a history of childhood adversity, also known as ACEs. And the term ACEs captures an array of different types of childhood adversity, including childhood abuse, neglect, and household dysfunction. An extensive number of studies conducted among diverse populations have repeatedly identified ACEs as a risk factor for a broad range of poor health outcomes in adulthood, including health risk behaviors, chronic disease, and mental health problems like depression, which is my area of interest. My master's research found that among a sample of over 4,000 primary care patients, 90% of adults who met criteria for depression also reported a history of ACEs. Adults with a history of 4 or more ACEs were over 7 times more likely to report depression than those with no ACEs. But despite the wide recognition of ACEs as predictors of poor health, ACEs are rarely addressed within primary care settings. And this represents a significant failure to integrate empirical research into clinical practice, since knowledge of a patient's ACE history could inform important aspects of healthcare decision-making. So why aren't ACEs addressed within healthcare settings? Possible reasons may include a lack of understanding about the pervasive effects of ACEs, misconceptions that the effects of childhood experiences cannot be modified later in life, or the fear of opening Pandora's box without adequate resources to support patients with ACEs. So to address these issues, the EMBRACE study was developed. The EMBRACE study is embedded within Albertan primary care networks, and it utilizes a multi-phased approach to enhance patient care for the 70% of Albertan patients who report a history of ACEs. The multidisciplinary research team is comprised of health professionals, including researchers, physicians, psychologists, and healthcare officials. As the student researcher on the team, I've had the unique opportunity to collaborate with diverse experts, including patients, as I explore my research and clinical interests. Since 2014, the EMBRACE study has worked with thousands of patients to identify a measure best suited to assess ACEs within primary care, to evaluate the association between ACEs and health outcomes, and to develop and evaluate a program that aims to improve health outcomes for patients with ACEs. And throughout each phase of the project, the EMBRACE study has worked toward the ultimate goal of improved patient experiences within primary care and toward the goal of improved mental and physical health outcomes among patients with a history of ACEs. And the work we've done so far has already impacted the delivery of clinical patient care. So for instance, many of the primary care clinics that are involved in our research have actually started implementing the use of our recommended ACE questionnaire in routine patient screening and assessment practices. And physicians have noted the value of this questionnaire in their assessment of patient risk, such as the identification of unaddressed psychosocial and even biological issues that might influence patients' current and future health risks. And they've also commented on how they've improved their rapport with many patients as a result of administering the ACEs questionnaire. And as you can see here, our ultimate goal is to develop and evaluate a treatment program, which will be offered within the context of primary care settings, and will teach adult patients about the possible impact of ACEs on their current health, and help them learn strategies to better cope with the effects of ACEs. Because although ACEs represent a historical risk factor that can no longer be changed in adulthood, many other factors that are strongly associated with ACEs are modifiable in adulthood, such as health risk behaviors, emotion dysregulation, resilience, and interpersonal problems. And these are the targets of our treatment program. Given the emphasis on patient experience and health outcomes, we knew it would be really important early on to develop a patient focus group. So members of our focus group were recruited from primary care settings, and they were recruited to reflect differing histories of childhood adversity, current health conditions, and socio-demographic backgrounds. So since 2015, members of the focus group have played an active role in the development, evaluation, and implementation of each of our phases of the study. Perhaps most important have been the contributions of the focus group to the development and implementation of our treatment program. Members of the focus group provided valuable insight regarding the format and the delivery of the treatment program, the content covered and the proportion of time dedicated to various areas of our treatment program, and even the type of language that was used by our facilitators. And following completion of an open trial of the treatment program, we ran a focus group with patients who had participated. And we asked for their insights on their experiences in the program and any feedback that they might have about the content or the structure of the program. Preliminary results from our open trial have indicated positive changes across a number of clinical outcomes, including anxiety and depression. So here we can see that from baseline to 3 months post-treatment, we've seen a 41% reduction in anxiety symptoms and a 39% reduction in depression symptoms. We're currently working toward beginning the final phase of our study, a randomized control trial in which we'll compare health outcomes of patients enrolled in our treatment program relative to control patients who will receive treatment as usual. And the feedback we've received from our focus group has been invaluable as we've worked to modify our treatment program. So in sum, the EMBRACE study is based on the combined efforts of a multidisciplinary team, and our achievements thus far and where we're headed in the future reflect our continued commitment to engage patients as partners, to focus on patient-identified priorities, and ultimately to improve patient health outcomes. Thank you.